I mean, I think sometimes public health can miss the forest for the trees, and that we can have a very specific idea of what public health is, that it only takes place, for example, in a health department, or, you know, okay, well, this is really interesting, but that's not really public health. Medicaid affects people's health, but that's health care policy. That's not really public health policy. And so I think sometimes you hear those types of things, and I always bristle a little bit because I've seen what it means for someone to get stable housing and their health outcomes improve, what it means for someone to have less violence in their community and their health improves. And so I think we agree that lots of things affect health, but I think when we talk about it, sometimes people who are kind of steeped in traditional public health miss that these other things also matter.
Hey friends, welcome to Public Health Careers. I'm Omari Richens, founder of the Public Health Millennial and host of Public Health Careers. Join us as we dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies to help you learn, navigate, and transform your public health journey. On today's episode, we have Dr. Breanca Merritt. Breanca is the Director of Policy at Trust for America's Health. She's a research-based storyteller who thinks social problems are complex and that community members know more about their experiences than we do. Her professional goal is to meaningfully engage residents, policymakers, and local leaders in timely, evidence-informed policy decisions to help inform her work. She conferred a Bachelor of Arts in Journalism at the University of Oklahoma, a Master of Arts in Political Science and Public Policy and Public Administration at Texas A&M University, then a PhD in Health Promotion Sciences at the University of Oklahoma Health Sciences Center. In today's episode, you'll hear and learn more about her journey to public policy and becoming Director of Policy at Trust for America's Health, her transformation, shifting her perspective from uplifting voices through journalism to using stories to inform public policy work, as well as the importance of education policy and how this intersects with health systems and social determinants of health, and much, much more. And if you have not as yet, be sure to sign up for the exclusive Public Health Careers podcast giveaway. We'll be doing a $50 Visa gift card and at least $50 worth of the Public Health Millennial apparel. There's a form below to enter. To enter, all you need to do is review this podcast and leave a screenshot of your review in the form. Additionally, you can share this podcast however you like on your Instagram story and screenshot that and then share it in the form. You will get 3 entries for every podcast review and 2 entries for every Instagram story screenshot shared. Be sure to do this before Friday, the 5th of July, so that you can enter and have a chance to win. And if you have not as yet, leave a review and then enter that into the form so that you have a chance to win. Enjoy today's episode.
Hey, this is Breanca Merritt. I am Director of Policy at Trust for America's Health, and you are listening to Public Health Careers.
Breanca, welcome to the show.
Thank you for having me.
It truly is my pleasure. I'm really looking forward to hear more about your journey into public health as well as the awesome work that you're doing.
Great.
So before we get into anything, how do you identify and tell us a little about your personal background?
Sure. I am a Black Southern woman. I'm originally from Northwest Louisiana. My family's been there for several generations, and that is home for me. A little bit about myself. I grew up mostly around a lot of elders in the Deep South. So hearing lots of stories, observing a lot of things in real time. I often tell folks about how I had one set of grandparents who tried to get ahead by living in a housing project. And in doing so, actually, they and many other family members were exposed to a carcinogen known as creosote. And so in their attempts to kind of move up the social and economic ladder, a lot of folks actually ended up living in some federal housing that was built on top of a cancer cluster, essentially. So the other set of grandparents who were a little more well-to-do and had access to certain things, their neighborhood still currently sits at the intersection of an interstate highway, an airport, and an oil refinery. And so I grew up really observing those differences in kind of how people live and how Black people in the South were kind of forced to live. My mom has worked in nonprofits and social services for most of her career. So I also had the privilege of going with her and observing just being a part of what those experiences look like, what it means to serve people in real time, connect them with supports based on federal policy decisions. So not having the language to really say what an inequity is, but observing that for a long time in places that are kind of historically known for that type of marginalization. So that really helped inspire me to get into generally trying to make people's lives better, recognizing that I'm not gifted in the role of direct services, but that I love the idea of public policy, the idea of changing things and making things better for people in ways that are structured and undoing some of the issues that exist. And even though I didn't have the language for that, that's definitely what drove me to do the work that I currently do. Things that I'm interested in now, where I live now, currently living in uh, the DMV, the DC metro area, after living in mostly in the South and Midwest. So this is a new experience for me. And based on what I shared at the beginning about living in Louisiana for several generations, one of my primary interests outside of public health is actually history and genealogy. So I love digging into not just my family's history, but learning about others.
I appreciate you sharing all of that because it really does ground a lot of this conversation as well as your journey into the work that you're doing. And you illustrated a lot of it very well. I kind of just want to hear more about maybe the interactions that you've had growing up with the elders that you said you were around a lot, and when did it maybe click for you that there were like injustices that were happening, or was that something that you realized from a very young age?
Very young age, I think just having that exposure and those stories so early. Again, growing up in the South, I didn't grow up in kind of, the places where we kind of historically associate with civil rights. So I grew up asking a lot of questions. I remember being maybe 3 or 4 and learning about and talking to my grandpa about presidential elections, which is incredibly young. For example, one of my grandfathers was one of the first Black police detectives in a relatively small town. And so then you start asking questions about what was that like for you and digging into that. And so understanding that folks just have a journey and that there are a lot of traumas. And I feel fortunate that I have folks I was around who were willing to talk about that and talk about the intersection of race and trauma, but also the joy that comes with, especially what it means to be a Black person and what it means to be a Black person in the South and persevering during times of, struggle, and being able to recognize the struggle, but also celebrate the beauty and the uniqueness of our experiences. And I think that really helps shape kind of um, how I view a lot of things related to policy and structures, and recognizing again that there are opportunities certainly at the individual level, but there's so much power in being in a space where you can change things to make things better for folks. So those aren't necessarily specific experiences, but just kind of just the privilege of being able to be around people who have lived and want to and are willing to give you this space so that cycles can be broken and you can think of things outside of yourself.
And highlighting the point of the importance of just sharing narratives, sharing stories, because like we think about data all the time and we think historically, but like how can we relate to the stories? How can we relate to the data points? And I also just want to also highlight the point of you sharing that, like, because many times we think of a lot of issues that people face, especially Black people, tend to be individual issues as an issue with the person. But then when you think about the story where you say your family was trying to get ahead, and they try to move into this complex, and from that there were health consequences that came with that, and it just shows like even when individual people are making moves to improve their and their families' lives, there are systemic structures and policies that are in place that are doing things to harm them and oftentimes harm their health. So wanted to ensure that we put a pin in that as well. And just getting into this other question. So like as director of policy at the Trust for America's Health and with all your experience, can you share more about the intersection of public policy and health disparities?
Absolutely. And that's a great segue. I mentioned obviously so far that I'm really passionate about recognizing the power of public policy. And I think there are so many people who do the quiet work of policy, not, necessarily legislative decisions or people who are in elected office, and not even folks who are the faces of executive agencies, but the folks who are really passionate about where they can fit in and make a difference, and understanding that I think, especially for myself as a Black person and a Black woman specifically, I think a lot of folks think it's pretty easy to separate, again, kind of these individual level choices and decisions from systems and structures. But as someone who is, at minimum, kind of a double minority in that space, and with the stories I've shared earlier, uh, there is so much reliance on having a government system that creates opportunities for people rather than takes them away. And so when we talk about the intersection of policy and health disparities, I mean, policy, broadly defined, is really everything for people who are relying on just an opportunity or um, something that works well for them, because the deck is often so stacked. And again, talking from being a Black female, but also talking about what it means to be, a person with a disability, an older adult. All of us, especially marginalized spaces, rely so much on having a system that works. And so often it doesn't. And so I find myself feeling some responsibility of how do I channel people's experiences and perspectives into what they might need, and what voice needs to be brought to that to help alleviate the disparities that might be created by policy systems, or policy systems that don't really work effectively.
And I look forward to hearing about how your journey got you to like this realization and got you into this position where you are trying to affect work from this policy perspective. And before we get into more of your journey, like what's the importance of having community and data informed research for decision making?
I think it's everything. And I think historically, especially in public health, we look at data as kind of quantitative numbers that tell us statistics about, sometimes about certain groups, but, disease states and things like that. But I think increasingly, which is wonderful to see at a larger level, we're valuing community as a source of data as well, and really saying, people's experiences are valuable. And it's irresponsible at a certain point to look at numbers and not think about the people who uh, are the numbers that we talk about. And so I think the more that we can kind of intentionally align community perspectives and feedback into the numbers and statistical trends that exist, we're getting richer information that allows us to better say, here's how we make a program work better for XYZ community. And we know that community needs it. And here's the thing that will work well. And just breaking those historical trends of saying, we're just going to go ahead and design this and put it out there and it'll probably work. And we know that that has not really, it doesn't really bode well for especially communities who are already at risk of certain outcomes. So without having those perspectives informing the work, you really miss designing programs, policies that work well for the people who need them most.
Absolutely. As I say all the time, it's like we have to ensure that the most marginalized communities are the communities that are given a voice, that are given a platform, a chair at the table, a new table, so that they can really inform the decisions, because historically they have not been able to do so, and historically that has left them disinvested and under-resourced and with these health inequities. What does public health mean to you?
I think of public health in the absolute broadest sense, which is the public's health. I think the average person, when they hear the word public health, that's what they think. And it's kind of, oh, whatever makes the public healthy. And I think within public health, as a discipline, we tend to narrow that much more into very specific disciplines or topical areas. But to me, public health to me is the broadest definition of how do we improve the public's health, and often through public means of moving that work forward. So I view public health as collaborative, and I view the public's health as being affected by many complex factors. And so if we're really intentional about what it means to improve health at a population level, it requires us to use any policy tool, lever at our disposal, even if it doesn't fit into a traditional bucket of what we think health means.
Before we get back to the show, are you passionate about public health and looking to elevate your career, brand, and impact? Join the public health community today. Gain exclusive access to career-boosting events, connect with like-minded professionals, and stay ahead with the latest trends in public health. plus enjoy mentorship and career support to help you thrive. You'll even learn tips and tricks on how I grew my LinkedIn by 2,000 followers in the last 6 weeks. Sign up before the end of May to lock in your membership at the current rate before prices go up. Don't miss out on this opportunity to grow and connect. Join us at thephmillennial.com/join or in the link in description and be part of our vibrant community dedicated to making a difference in public health. Let's build a stronger future together. Now back to the show. And before you got to maybe the realization or understanding of public health, you decided to pursue a Bachelor of Arts in Journalism at University of Oklahoma. Talk us through that thought process of going for your undergrad degree.
Sure. I wanted to tell stories. And you know how you take those tests in, I don't know, middle school or high school, those aptitude tests. It's like, oh, here's a career path that works for you. I was never, I think a lot of people in public health kind of start off in spaces that, most people don't start off, one, knowing what public health does, much less pursuing a career in that. I just knew I wanted to write and I knew I wanted to uplift voices. And journalism made perfect sense to me. I started pursuing that in high school and just knowing really clearly I wanted to go to a place with a good program, with good funding that would allow me to do that and build those skills. At some point along the way, stories to me also included analysis and numbers. And sometimes journalism doesn't always have the space to do the analysis that leads to change. And I realized that the change in the system was more important to me than just the story. And we know that there are plenty of super impactful journalists and writers and outlets out there. But for me, I wanted to see something so naively, like if I pursue something that allows me to do more analytical work, that will allow me to create more, structural change without using those words. And so that's why I pursued it. I really wanted to be a storyteller. And then it got to a point where doing work in policy to me was a form of storytelling in journalism. And just kind of the next step from writing stories and editing headlines.
Tell us more about that transition and thought process.
Yeah, I had a great mentor in undergrad who taught a class in education policy. And I told her kind of what I thought I might want to be when I grew up. At that point, I was like, I think I want to be a policy analyst. I don't really know what that does. That seems like something that fits what I'd like. And she was like, let me sign you up for this program. The deadline just passed. I'm going to write you a letter of recommendation. Trust me, this will be great for you. And so I went to this program focused on not just political science, but specifically on going into the professoriate, getting a PhD, and learning a lot about the political system, and specifically the political system as it relates to race, poverty, people of color. And so it sounded like a great gig. I enjoyed my time there. I remember the last day they asked who wants to get their PhD, and everyone raised their hand except for me. I was like, this is weird. I do not want to get a PhD. This is great. I get my master's degree, call it a day. I'm not trying to be like an elitist with a doctorate and, flouting my my credentials and all that. So I think at that point, while I was still in undergrad, I really start to process that a little bit more in terms of, okay, well, if you really want to do something with this, master's degrees are a dime a dozen in some spaces. And if you really want to do something, maybe it is great to build that research arm. You go from storytelling with people to maybe storytelling with people and numbers and statistics, and having that PhD might give you the boost. Also, fiscally, a lot of doctoral programs pay for their students to get their degrees. So it also made a lot of financial sense. I graduated. Also, I'll take your name. I'm a public health millennial as well. And so coming out during the recession was not a great time. And so it was pretty much like you need to go to grad school because you don't have any options. In addition to, this would be great for your longer term career. And I just figured I would pursue that work straight out of undergrad to save myself time and money. Then hopefully by the time I got out, the recession will be gone and I can actually get a job. So there are lots of like practical reasons, but also a lot of passion reasons and really being thoughtful about where it made sense to use my skills.
Yeah, absolutely. And I'm definitely going to come back to a couple of things that I jotted down there when we get more into the PhD journey. But can you share more about some undergrad takeaways that you had, as well as that transition into your Masters of Arts in Political Science and Government and Public Policy and Public Administration at Texas A&M?
Yes. So I think for me, it was definitely about um, enjoying learning. As a journalism major at a solid journalism program, one of the blessings is that you get to take classes in a whole bunch of stuff. So yeah, you learn some technical stuff about journalism, but you also learn you're required to take courses in you just have tons of electives to take things in the premises we want you to learn about a lot of different stuff. And so I was taking classes on genocide. I took classes on you know, Latin American politics. I took classes on, anything I could get my hands on. And it was just such a rich experience. And I think sometimes when you're in college, you focus so much on getting the degree. At a certain point, I probably would have changed my major, but it didn't make sense because I was getting exposed to so many great um, insights and knowledge bases from these great professors. And I think just taking the time to really learn, you don't get to formally learn in that space all the time. And so I think if folks want to pursue any type of degree, just making sure you get as broad of an exposure as you can, because there aren't a lot of opportunities outside of undergrad to get that level of knowledge and just challenging yourself to learn more.
Absolutely. And what was the thought process of going into your master's program?
Well, so it ended up being a master's, but that was actually a doctoral program that I started off in. And the process was I will get my PhD in public policy. I will graduate in 4 years and I will go work for the federal government where I can do policy analysis. That was the goal. I was going to get in and out and be done. Got there, really had a lot of great administrative exposure and opportunity to learn about to do in more real supported space around survey development and administration, project management and administration, mentorship of undergraduate students. So a lot of practical skills in my role in research, specifically focusing a lot on education policy. So I mentioned I took that education policy class, and that really is what spurred me into thinking about education as, again, one of those big systemic issues that we could address through policy change. So that's what really led me there. And then while I was there, I was able to do that intersection of disparities in education with equities and inequities before that was even a thing. And just a lot of great experience there. What tripped me up a little bit was this pressure that I felt to get a PhD and to become a professor and work in academia. And I was very clear going into this, as I told you, with me demonstrating not raising my hand at that in that program. I was not trying to get a PhD to work in a university system. I wanted to use the PhD to make systemic change in government, whatever that looked like for me. And I think getting stuck in that, and I felt like no one was really listening to that. And it wasn't a secret. I put it in all of my, application materials. I said it the whole time I was there, and it kind of created a bit of a target on my back a bit. I think it wasn't really, it just wasn't a great fit ultimately. There's nothing wrong with going into academia, but to be in a space where that felt like my only option, I was starting to compromise with myself and say, I don't think I think I will go in academia. Yeah, I could be a professor and that would be okay. And I kind of lost track of who I was in that process. Ultimately made the decision to leave with a master's degree. In the work that I was doing in education policy, I had a colleague who was getting into childhood obesity spaces in the intersection of education and schools and the obesity epidemic. And, 10, 15 years ago, that was actually a huge topic. We still have a childhood obesity crisis, but at the time that was the thing that really made me think a little bit more about, we can't just talk about students in schools. We can't just talk about school districts. Kids are affected by everything. Where is the space where I can talk and analyze everything? And it ended up being public health. And so when I say I take the broadest definition of health, that's the perfect example of how I kind of transitioned from education affecting students' outcomes to recognizing that health systems, health opportunities, lifestyles, parental decisions, all those things go into kids' health as well. and that public health was a field where I could really engage community, where I could work at the intersection of analysis and statistics with having perspectives from real people, and valuing that community knowledge. So I went from being kind of this hardcore policy analysis statistician perspective to, oh, there are opportunities that actually fit better with what I want to get out of this work.
And what about education policy in the beginning really stood out to you as something that like intrigued your interest or something that began that passion for you?
I think that's just the thing that we talked about most for a long time in terms of a place where inequities could be addressed. Growing up, I went to a public magnet school, which sought to bring kind of the best and the brightest to, these school systems, and it was public. And there's actually the Urban Institute has a tool you can use that shows you how segregated or not schools are. And they do it for decades, and you can look at the trends over time. And if you look at my elementary school, when I was a kid going there, it was pretty integrated. We had a decent amount of Black kids for a place that had a lot of Black students, and it was competitive. And if you look at it now, it's dropped off. At the time, it felt like we were on a trajectory to keep kind of thinking about how to improve systems for schools and education, or how to improve systems for people, because it felt like through education, through the civil rights movement, that was kind of like the hallmark thing. As a journalism major, I really pursued a lot of education and government related topics. And to me, that just felt like, of course, that's the place to study equity, because they've been doing it for a long time and they've done it well. And so that is what initially brought me to that work. And as I talk about hearing about family trauma and other things, like my mom would say all the time that integration was the most traumatic experience of her childhood. And that's why she went to an HBCU for college, because it was just a lot. It really affected her self-esteem. And so understanding the nuances of education in a space that talked really openly about race, talked openly about poverty, and policy tools to address that, it just made sense for me to go there. So it's interesting how that landscape has shifted as we now see so many attacks on public education, that at the time, though, it really felt like that's where I can learn how to do this work well.
Okay, fascinating. And to take you back to your time at Texas A&M, just wanted to quickly go over some of the positions you had while you were there. So you were a graduate research assistant for Project for Equity, Research and Governance at Texas A&M, and then you also had a couple graduate research assistant positions, instructor, project manager for youth and family asset programs at University of Oklahoma Health Science Center.
Yeah, so I ended up leaving Texas A&M and moving to Oklahoma to pursue my doctorate there. It felt like a very natural fit, because not only did they accept all my political science and policy credits, but they're very much like, we need more people who are studying public health in a way that is broad and driven by policy. And we're getting to the point where we're starting to talk more about social determinants of health and recognizing that everything is kind of a health issue. And it just felt very natural to move there. So to your point, I transitioned to the Health Sciences Center at the University of Oklahoma, and worked initially in their public health training center, working with mostly new state government employees in the state public health department, and training them on the 10 essential services of public health. And then the bulk of my time there, I was a project manager for work with the American Indian Diabetes Project to help do evaluation, to manage this evaluation focused project and develop programming for mostly rural Native American families.
And did you have the word for public health? Like how did you find out about public health? Was that something that you learned throughout your like bachelor's into initial PhD, or like how like okay, tell us about that.
Yeah, I knew nothing about public health in the way that we know of it as professionals. And like I said before, I think people just kind of end up in public health. And so for me, once I got a taste of this childhood obesity work and knowing that public health was leading a lot of those efforts, I just started doing my own, people say do their own research and they don't actually know. But I think being in an academic institution, you start to figure out what, really truly what is this work and where does it go. So I started off just as part of my research having to cite articles and dig into public health that way. I was also really fortunate that in between my programs and my jobs, I was able to go home to Louisiana and spend a lot of time with folks who were working in what I would call public health spaces and human services spaces as well, and getting an in-depth sense of what that meant. And so it was great to kind of get an opportunity to kind of see public health in addition to researching public health before I really got into the field. So no, prior to, that time, I did not have a clue it existed. And honestly, I think if I knew about it in undergrad, I don't know that I would have pursued public health meaningfully either. I knew other folks who were interested in it, and I just kind of associated with not even a medical or clinical model, but just something that was for other people because I was interested in education, I was interested in policy, and public health to me did not equate with policy. And so figuring out that niche of my interests with the opportunities that public health offered is really what got me into it.
Yeah, and I just like how you started off like in journalism, interested about stories. Then from that, taking the stories and how do we tie these stories to policies, and wanted to like combine all of that, and then going from like education policy to leaning more broadly that like health is impacted in so many ways, to then learning about public health, and then pursuing a PhD in health promotion sciences at the University of Oklahoma Health Science Center. So, what was that push for you to get this PhD? I know earlier you also shared that you felt it was elitist to get a doctoral degree. What shifted in your perspective?
Going back to the elders and realizing that, it wasn't an issue of ability. It's just an issue of does it make sense for what you want to do? And if
Hmm.
that is what you want to do, then that is what you pursue. And, at one point, I didn't mention this, but coming out of undergrad, I was thinking about going to law school. Because again, I like policy, and the only thing I knew about policy was legal stuff and not policy, was kind of the other side of that. And realizing that, for me, um, I was more interested in the research and the questions and the ability to pursue and probe things. And that's what PhDs allow you to do. And so there's a freedom in that um, that made me stay on that course of just get the degree. You are a good fit for this. You just need the right space to do it. And so it was really about having the mentorship and support um, from a few faculty members in Oklahoma to really just kind of get the nudge to pursue that work in earnest. So to me, one thing that was going through my head during that time was um, don't be concerned about what it looks like, because I think a health promotion sciences degree isn't as sexy as like epidemiology or health administration. And so I was also kind of thinking, is this really the right thing for me? But content wise, yes, I care about promoting people's health in the context of public policy. And that's what made it a good fit for me. So I had to kind of put away these notions of, not just what things look like, but, also this idea of like, you don't have to be an elitist, you can be yourself, and that's fine. And so for me, it was purely about like, where can I find work at the intersection of public policy and health outcomes? And that to me was the best fit. And then doing my work in the meantime with rural communities and traveling across the state, 2 hours one way, multiple times a month. It's just a great opportunity to really reflect and think more cohesively about how policy works and how complex it is beyond, at least in public health, beyond healthcare, hospital administration, and really digging into the numerous tools that are at our disposal to affect health.
And you brought up the point, and I think it's a point that a lot of people in public health early in their career also think about a lot is, okay, I want to do health policy type work. I need to get my JD. I need to become a lawyer to do this. And to your point, you don't have to do that. Can you talk maybe a little bit about the difference in approach, or maybe the difference in how you can go about working in policy without a JD versus a JD?
Yeah, and I think I take the broadest definition of policy as well, right? Because there are lots of people who are topical experts and just have tons of knowledge, and they don't have a PhD, don't even have a master's degree. These are people who have said, I understand that these policy systems need to be changed. and I want to do something about it. And so it's really about finding your niche. Having worked in a lot of different spaces that we'll talk a little bit more about, some of the best policy people, like I said, don't have 1,000 degrees. A lot of folks have lived experience. We used to say in state government, the best policy experts are the people who have to use them. So we're up here designing, applications for WIC or SNAP. Where are the people who have actually accessed it? And some of the best workers in that space, you're affecting public policy change by being able to vocalize what you understand does and doesn't work on a Medicaid application, for example. And so to me, it's just about finding the space that you're most passionate about, being willing to learn, grow, and listen to people in that work. You don't have to be a legal expert in a JD way. It's a different type of law. What we're doing is more programmatic change, systems change that doesn't always take, the form of a legal document. And so it's actually a lot, I think it's a little more freeing to be able to have this space to create and influence in that way, and not necessarily in kind of the, you need to understand how the legal system works. The policy system is a lot more broad, and there's a lot more nooks and crannies in there to, I think, affect change.
I appreciate that perspective because I think it gives power to like your everyday person to think about, okay, public health is everything. What are the things that are impacting me in my life? Am I passionate enough to make this something that I want to get dedicated to, or I want to organize and advocate around, and to that point, become an expert in the policy kind of work. So I appreciate you raising that up. And just like to that point, I think like we all have a part that we can play in advocating for policies and for systems changes that improve our community's health.
Yeah.
So after you graduated with your PhD, you went to work at the Indiana University Public Policy Institute as a senior research analyst. Tell us about that position.
Yeah, when I was leaving, I knew I wanted, again, I had this goal. I was going to be a policy analyst, and that's what I was going to do. So I really started looking for lots of public health opportunities in that space. Maybe naively thinking too that the PhD would help me in the public health space, and it didn't. Our family was relocating to Indianapolis, which Indiana has not historically had a super strong, not just public health system per se, but known as being kind of an innovative space, right? It's kind of, culturally, folks will say in Indiana that, people like to take things slow, very trying to, we're not going to be the first to figure stuff out in Indiana, which is fine. But I had a really hard time finding just like a straight up public health position. I knew I wanted to do policy work, and I was just really fortunate to get in contact with someone, the director at the time of the Public Policy Institute at Indiana University, was like, hey, we really need someone like you to do work with us. I was not really interested in working there because they didn't really do a lot of work in public health. And because I was passionate about disparities and inequities, that really wasn't part of their portfolio either. And so it was kind of a leap of faith to take that position and kind of not really seeing anything, but trying to see something before I could see it. I had a vision of what could happen, but no real, existing things that would suggest it could happen. So doing that work really started off good at the beginning because it gave me the opportunity to really travel across the state. I did some work with the Lieutenant Governor's office in the state of Indiana, traveling across the entire state, getting to know all these counties, getting to interact with experts and people across the state, across a number of different topics, not just health, but including health. And so it was great to kind of get a bit of an intro to the state and to the culture. It's really kind of reinforcing the importance of what it meant to kind of be on the ground and really doing research that could affect people meaningfully. And at the Public Policy Institute, their work was really about evaluation and engagement and doing work that policymakers could use at state and local levels. And so working across topics around poverty reduction and, criminal justice, you name it, I had the chance to kind of do social determinants of health without it being called social determinants of health. So I was literally doing work in pretty much everything but traditional health. And so it was a really great opportunity to dig into all these other really interesting topics that affected communities I cared about. And that also led to me creating a research center as part of the Institute to kind of further some of those topics.
You can't just say that. Like, how did that happen? Congratulations, that's dope. And not many people, like, I think, can say that they created, founded, or was founding director of a center for research on inclusion and social policy. So how did that come about?
Just recognizing the gap in opportunity. I mentioned Indiana is not a state that's known for kind of being first and innovating on certain topics, and equity and inclusion is definitely no exception to that. And there were not other research spaces talking about these issues, especially when we're talking about equity, but also when we're talking about human services, poverty, and thinking about the fact that those things are all very closely related. And so I had a ton of support from the leadership at Indiana University to pursue this. It was an idea. People have ideas all the time, but you need somebody to believe in that. And so the fact that we were able to pursue that, including folks who are thinking about what it means to develop a center like this in spaces that are pretty conservative politically, including people who are conservative themselves, kind of trying to think and strategize about how do we get this across the finish line. And the actual name was in an effort to try and be, talking about inclusion versus inequity. That's why the I is inclusion, because there's this idea of, maybe people won't appreciate or feel challenged by inequity. And this is before it was a thing. It was, 2018, I think, when we started launching the work. And so to be ahead of that was really great. And so by the time COVID rolled around and people were really starting to talk about George Floyd and inequities and disparities, we had already kind of been doing that work for a while. And it was just really wonderful to feel like, based on my story that you've heard so far, just really pursuing this idea that policy matters and policy matters to reduce inequities, and have that, turn up in a research center that looks at that work really intentionally. Felt great. And we had a great team, and we still do have a great team of people at that center who are passionate about those topics and willing to not just do research, but do applied work that community leaders can use, that governments can use at the intersection of those topics where it's historically been pretty quiet where we were.
Well, that's awesome. I'm glad that you're able to do that, and kudos to the work that they continue to do there. After that work, you moved on to become the Chief Health Equity and ADA Officer at Indiana Family and Social Services Administration. Tell us about that position.
Yeah, so I mentioned earlier that I've always wanted to work in government. And so this was just a wonderful opportunity to do that. The secretary of that administration at the time reached out and was really interested in making sure that this is a position they've been wanting to do for a long time. FSSA, as it's abbreviated, has historically been kind of the Health and Human Services primary agency. So Medicaid and related services, it's separate from the public health department, but the secretary at the time came from the public health department and was all about social determinants of health, and really wanted to make sure that we had an office that focused on those issues. So they developed one, but needed someone to lead it. And so the timing was really fortuitous with everything that was happening with COVID and the work that they were doing around COVID disparities and data and access to services. And so they created this position that was new to not just address health equity writ large, but really thinking about the intersections of equity and public policy. The ADA portion obviously focuses on people with disabilities, which is a huge component of the people who receive the social services that are offered by state and federal policy. And so also uplifting the idea that not only do people with disabilities matter, but the state is putting forth such a title that we ensure that they're incorporated in the work that we do pretty explicitly. So it's one of those decisions where it's very easy to make, but it's also very difficult. I loved working at CRISP, which is the acronym for the center. Loved my team and hated to leave, but knew that this was a really great and unique opportunity. And I did not want to pass that up, especially when we work with them as an organization as kind of like here's thinking about research and partnership opportunities to sort of be on the other side and really get a better sense of how things work in practice, I couldn't really turn down that opportunity.
Yeah, that makes sense. Because you never know when right opportunities are going to fall in front of you. So I'm glad that you're able to lead some of that work and get some of the experience in the government as well. And after this, you progressed to become an adjunct professor and community scholar at Indiana University, Purdue University, Indianapolis. Tell us about this.
Well, I was actually a clinical professor while I was working at Indiana University. So I already had kind of a faculty classification, which is hilarious given that I have said throughout my life I don't want to be anywhere. But I did have that classification. And so I started teaching classes and things while I was there. And so when I left the university system, it was kind of a question of, can you still stay involved? And do I want to stay involved? And importantly, that community scholar piece is really important because it acknowledged the fact that, I'm not just teaching classes, but really being appreciated for thinking about community and things that are more applied. And so I held that role both at the School of Environmental and Public and Environmental Affairs, but also in the Africana Studies program. So getting to design really cool classes around, race and Black folks and public policy, and reaching students who are interested in that and not really seeing how that aligned with their community. And so those types of opportunities are really great to still have the connection and get a sense of, what the latest things are happening research-wise and otherwise in those spaces.
That's awesome. And you speak a lot about like making the work that you're doing or taking the work you're doing and making like actionable, making it like community oriented. For people that are out there that maybe like struggling to see how they can take their work and make it like more community oriented, community focused, community driven in the work, what kinds of like tips or advice would you give to them? And let's imagine this person also has like a PhD.
Oh, yeah, I think you have to just be super humble. I think especially when you get these degrees, people make you feel like you're an expert and you're so smart, and you are. Congratulations. Like, that is an accomplishment. But I think I've always felt a pull toward people because I know that's not my gift. I mention my mom a lot, and she's just so great at engaging people where they are. People who have slept in their car overnight and come into her office. And, that's not a skill that I haven't, but I know that I want to make things better for people with those experiences. And so you just have to be willing to do that. I'm comfortable being in those spaces because that's what I've grown up around. But if you've never done that before, I think it could be a really challenging process to do that. I love to talk about one project that I did when I was at the Public Policy Institute, which was working with doing some work around crime prevention with youth, and literally going to this community center at least weekly for months at a time and just sitting with middle school and elementary school kids and listening to them and making them feel comfortable to talk about, ultimately talking about traumas and other things that were related, but not what I expected to hear. I think being in those spaces, as close as they can be related to your work, there's always an opportunity to dig into the why. And for me, community engagement is about the why. I can crunch the numbers, I can read the reports, but if I don't hear like why something really matters to somebody or why they need something, it just feels empty to me. So I think if you want to do better work, especially if you have a PhD, you have to figure out the why, and the why often comes from the listening and the humble and intentional engagement of people who might have different experiences than you. So that's what I'd recommend.
I appreciate that. I appreciate that a lot. I like that community engagement is about the why. Like, I think that's a good perspective going into it. And now shifting to your current role, you are director of policy at Trust for America's Health. And I don't know who to give this shout out to, but Trust for America's Health is one of my favorite newsletter emails to get in my inbox. You all share a lot of information. So whoever needs those kudos, shout out to you all. Keep doing the work that you all are doing. But getting back to like your role of directive policy, like tell us about that transition, that thought process for you of wanting to shift this organization, and then tell us maybe a little bit more about Trust for America's Health and the work that you lead as Director of Policy.
So one thing I'd say that I've been told about myself is that I am a serial entrepreneur. And so one of the things you'll see perhaps in the trend line of the different roles that I've had is that I've kind of had to start and build things from scratch. Whether it was at the state where there's tons of support for all of the work, but it's a new role. All the positions that I've had have been new. So this is actually one of the first times I've had a position that actually existed at some point. However, it was still kind of a crossroads for the organization in terms of how they wanted to build out that position and the work that the person did. And so it was just it's been a great opportunity. So the shout out goes to literally the entire team. We're a small organization, but everybody puts in the work, which is wonderful. Came across it just looking for health opportunities and really building on the health and human services work that I've been doing. But also people engaging you too. And so I think getting to learn more about TIFA, which I had not known a lot about their work a ton before, and seeing the opportunity and the marriage of the work that I'd done with kind of research, as well as the work in public health, the work in human services, and seeing the opportunity of, wow, this is an organization that values all those things. The role itself really focuses on policy development and identifying opportunities for where our organization can go in terms of policy innovations, programmatic supports, listening to states and localities about what their needs look like. And so the fact that all those things could coalesce into one role at a time where we're already relocating, to the DMV area, it seemed like a really great fit and an alignment of the work that I've been doing to that point.
That's awesome. What are some of the policy priorities that you all have?
As an organization, we really focus on traditional foundational public health first, considering issues like public health infrastructure, the fact that, we've just come out of a once in a 100-year pandemic, and people do not trust public health and are consistently trying to fund public health at lower levels. How do we ensure that the programs that need it have it and can be sustained in that work? In terms of topical areas, we definitely have a health equity focus, but across numerous topics: behavioral health, nutrition, physical activity, environmental health, and climate. We also have a rich portfolio in older adults and healthy aging. And so recognizing that public health has kind of disregarded that population for a long time, and what opportunities exist to better align those concepts, activities for healthy aging and a healthy lifespan. So we have a lot of different topical areas, but we're also very open, of course, to new and emergent issues. We've definitely been we have a project that I lead that's been going on before I got there related to social determinants of health and, things outside of traditional public health drivers, and figuring out organizationally where do we fit and how do we support the sectors that lead, issues related to housing and others. So it's a really rich environment, and those are the types of topics we pursue. We're also open to, as the environment changes and the policy landscape changes, how do we integrate public health in that work, and what is our role as an organization to do that? And so that's part of my job, to help figure out and support.
And what does your day-to-day, or maybe week-to-week roles or days look like?
So one thing about pretty much all the jobs that I've had is it depends. But right now, with some of the work that we're leading related to promoting health and cost control in the states, also known as FACTS, right now that project is taking up the bulk of my energy, and it focuses on primarily right now engaging states and localities in their challenges and opportunities in enacting evidence-based policies related to social determinants of health. And so that involves working with people outside of DC, which is also incredibly energizing for me. So that's something that I'm doing right now that's pretty time consuming, but otherwise it's really about supporting others, identifying new innovations. That means going to conferences, learning about kind of what the latest and greatest is in this space, not just in terms of policy strategy, but in terms of issue areas, and figuring out where we fit. So there's a lot of networking, working with people directly. There's a lot of report writing and support as well. So you mentioned a lot of the data and outputs that we have. And so directly supporting that work where it's possible, hosting webinars and identifying ideas for webinars that reach broad public health audiences. Most recently, I've co-led one related to economic opportunity. So again, getting people in public health to think beyond traditional public health, and just identifying those spaces. So that's probably not a single day, but the types of things that I do that would influence what I do on a day-to-day basis.
And on that train of thought, like, what are some of the things that you think traditional public health misses that's important for public health, such as economic development?
Yeah, I mean, I think sometimes public health can miss the forest for the trees, and that
Mm.
we can have a very specific idea of what public health is, that it only takes place, for example, in a health department, or, okay, well, this is really interesting, but that's not really public health. Medicaid affects people's health, but that's health care policy. That's not really public health policy. And so I think sometimes you hear those types of things, and I always bristle a little bit because I've seen what it means for someone to get stable housing and their health outcomes improve, what it means for someone to have less violence in their community and their health improves. And so I think we agree that lots of things affect health, but I think when we talk about it, sometimes people who are kind of steeped in traditional public health miss that these other things also matter. And more importantly, maybe lack a strategy for how we build those bridges. And I think at a time where public health is under attack, both fiscally as well as a concept, building those bridges is so important to ensure the work gets done and that we're ultimately improving people's health outcomes.
Love it, and yeah, I couldn't say that better. But yeah, when we do think of public health in the broadest essence of it, and understand all the dynamics outside of traditional public health, then we are able to bring together those diverse teams of people and people in community with lived experiences to work on those issues, and then we do get that big catalytic system change that we do want to see. So appreciate you raising that up. What do you like most in your job as director of policy?
One thing I mentioned were those listening sessions and engagement we're doing with people outside, like across the country. And we couch those in the concept of convening. So we bring people together from, typically people who are kind of national leaders in different spaces to figure out kind of what is going on this topic and how do we pursue it. And it's just the perfect idea of, figuring out, bring together people who know. And I think, again, broad definition of experts, right? Thinking about people with that lived expertise and experience, but kind of bringing people together to inform what is really important and what do we do about it. And to me, that's just the whole reason why I got into this work in the first place. It's saying that we can certainly distill and develop an evidence-based approach, and that you are part of that evidence, and we need you to come with us to do this work well. So I think the work that we do around convenings, identifying major policy areas and issues, and really kind of taking the blinders off and closing those gaps for us is just an awesome opportunity, and not one that a lot of folks get to have. So you're working with people at these levels that are brilliant and have so much insight in how things could and should work. By far, I think the most energizing part of my job.
Awesome. And before we move on to the last part of the show, I would like to ask, where can people connect with you, and where would you like to see yourself in the future?
I've stopped saying where I want to see myself in the future, because I've told you throughout my life, I say something. It's like, no, that's not actually what you're going to do. I think I just need to be in a position where I can continuously work toward system improvement. And I don't know what that looks like. I don't know if it's in government. I don't know if it's in the nonprofit sector. But whatever it looks like, to be an agent of change and systemic change is where I like to see myself. I don't have to have the top position in anything. I just want to be a part and be able to, work behind the scenes to continue to tinker to improve the systems that we do have.
Love that. Love that. And I think that is probably a model or like a thought process that more people are shifting to, is like, how can I make the impact, as opposed to like, how can I have this specific job, which I think is also helpful, because when you aim towards like one thing and you don't get it, you could be disappointed. But when you have a broad understanding, okay, this is what I want to impact, and it gives you so many different perspectives to attack that issue that you are thinking about. So appreciate you sharing that, and I look forward to continuing to see the impact that you all are doing, and you will make in your career. So really appreciate this conversation. I did have a note here that I wanted to come back to just ask more about, now that you've like spoken more about your career. You've spoken earlier about like not being stifled in direct services and really wanting to work in public policy. So is that something that, like, having had the career that you've had so far, are you happy about that? And maybe like reflecting on that statement.
Yeah, I mean, I think I'm I feel very fortunate that people who work in more direct service spaces have been so open to me being with them and not having that experience. Um, and just simple things. I remember volunteering for something as a grad student or maybe an undergrad, and it was distributing backpacks to low income families in advance of the school year. And they'd invited all these people. Not a lot of folks showed up, and somebody was like, "Oh yeah, we should just call them." And everybody laughed. And I was like, why is that funny? Like, why wouldn't we give them a call? I didn't say it out loud, but I'm thinking, like, is that not the right thing to do? And they're like, people don't give phone numbers, their bills aren't paid. You might call that number and nobody answers because it's been disconnected. And so just things like that are so simple that I think if you only pursue kind of this policy leadership path, you miss out on so much of that. But I also know that that's just not where my gift is, and that's okay too. That you go where you feel like you can be valued and where you can work the muscles that you're good at, but it doesn't mean you disparage other people's work. You just find kind of where the opportunities where we can share with each other. I think a lot of folks that I've worked with in those spaces also value the work I do, in the sense that sometimes I forget that a lot of folks don't get the chance to engage with an executive at a Health and Human Services agency, and what it means for them to also feel like I'm accessible toward, like, you're complaining about how SNAP doesn't work. Is there something that I can do, to make that better based on what you're sharing with me? So definitely made the right choice, but recognizing the opportunity and collaboration and partnership where it's appropriate.
Yeah, absolutely. We cannot solve these big wicked problems by ourselves. There's definitely a need for collaboration, and I like the point of like you staying where your gift is, and like falling into like what you are good at, which I think is important for people to realize. Last question before I move on to the Furious Five. You spoke about we spoke about like journalism being the beginning of your journey, and you like listening to your elders, hearing the stories of your family, to then you wanting to craft or maybe like utilize stories and uplifting voices into policy and into the policy discourse. Any reflections on that trajectory or that thought process, and how do you feel about that now?
Yeah, I mean, I think I did what I was supposed to. I think when it was happening at the time, I felt like an idiot because I'm thinking, who's going to hire me? It doesn't even make sense to have a journalism degree, a policy degree, and a public health degree to be where I'm from. And none of it made sense. And it felt like I was walking in a wilderness for a long time because it was a path that I didn't think people were really taking. And I think, again, going back to where your gifts are and your abilities are, that it's so important just to not be afraid to forge your own path. And I think, as we talked about, kind of the elders recognizing the parallels, even though they're not exactly the same, that they had those experiences too. They've had detours and challenges and systemic pushback on ideas that I've faced throughout my career as well. And so even though it looked different, 70 years ago, that perspective is so critical to kind of persevering through all those different changes. And I think now when I tell my story, people are like, oh, of course that makes sense. And if you told me that, 10, 15 years ago, I'd be like, there's no way this makes sense. I just I'm proud of myself for kind of sticking with what I felt was right instead of what other people probably thought would have made more sense.
Well, I appreciate you raising that up because I feel like there are many, many people out there that are probably in that similar situation where they feel like they aren't doing the right things and their journey is just kind of like all over the place. But you never know how those experiences are really going to culminate and give you the experience and to get to the positions that you want to get to and do the work that you want to do. So I'm glad that you were able to go through your journey and get to where you are right now and share that with us. And before we get out of here, I'll move you on to the Furious Five, the 5 questions I ask all guests. So, number one, what advice would you give to a student trying to pursue a career in public health?
Don't be afraid to do anything to learn more about the community that you want to serve. I told someone how when I was pursuing my public health degree, in addition to working, I also would just like take these opportunities to work with like take a class project and turn into a partnership or a volunteer opportunity. And someone was like, why would you do anything for free? And I think, there's so much focus, especially with younger folks, about monetizing everything. But it is okay to just kind of show up somewhere, reach out to somebody. And I think people appreciate your interest in something that maybe seems a little different from what you want to do. And so I think just don't be afraid or think you don't have enough time, because like I said, even if you're a student who's working as well, like you have more time than you think to take that space, maximize a class project into something that challenges you and really maybe puts in perspective new ideas that you hadn't considered before.
Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
Apparently do whatever you want and then you'll end up doing that work. I think the work that I do though is very visionary type thinking. And when you were starting off early in your career, people do not value visionary thinking. It looks disorganized and doesn't result in concrete outputs. Whereas when you're early in your career, people want to see you kind of doing things and checking boxes. And so if you want to get into more of these policy and strategic thinking perspectives, lean into your ability to generate ideas or think outside the box if that's something you're good at. That's the type of perspective that's needed to do this type of work. So learning, thinking outside the box, and just being exposed to things that are different from your day to day is really critical to do this work.
Number three, what's something you're working on improving in your life right now?
I'm trying to practice touching something once. And by that, I mean touching it emotionally, touching it physically. So that means if an email comes in, respond whenever, but don't think about it too long. Don't, get it out the way. If it's, oh my gosh, I'm so sad because, I forgot to call my cousin back. Be sad, call them back, get it out the way. I'm really trying to do better about not wallowing positively or negatively in certain activities. And if I can just touch it once, get it off my plate, it makes things a lot easier for me.
That resonates a lot with me right now. So I appreciate you sharing that, and to the point of like when you like think of something but you don't take action on it, then it's on your mind until
Yes.
you take action on it. So yes, it is better to just get it out the way. So I appreciate you sharing that. Number four, professionally, do you recommend anything?
Oh my gosh. That is such a hard question because it can literally be anything. Um, I mentioned before, I love history and genealogy. And I love reading books specifically about kind of how do we connect the past with the present. The phrase, people who don't know their past are doomed to repeat it. And I fully agree with that. And so anything dealing with history in any way that is often written by a journalist. Journalist written books are my fave. So I have tons of recommendations. Probably one of my favorite is The Warmth of Other Suns, which tracks the Great Migration from the Deep South of Black folks to the Midwest, East Coast, and West Coast. And it does in a way that's storytelling, but also really focuses on structures and systems. And you kind of see these parallels that happen in real life. So anything that makes those connections is really a good read for me.
Appreciate that. And last but not least, if there was one piece of advice you'd give to your younger self, what would it be?
I actually got this advice as I was graduating undergrad from one of my good friends, and she didn't know she was giving me advice. And she said, you never know who's looking at you. And I didn't really think of myself as, even though I had like leadership positions and all those things on the resume, I don't think I really viewed myself as somebody that people would look at. And I think I thought of that as a one directional thing, that you're supposed to be this great, perfect person and people look up to you. And now I understand that it's not about people looking up to you per se, as much as being true to yourself and not being afraid of what that truth might mean to other people. And so never act as if people are looking, but that doesn't mean, it means be true to yourself. Don't be afraid of opportunity, and don't be afraid to mess up too. Being transparent and true to yourself is the critical thing. And just understand that people are always looking, no matter, and again, not as like a fear tactic, but just as a, hold strong and be true to what you value and who you are.
Couldn't end it any better. Thank you all. Thank you so much, Breanca, for coming on, sharing your story, sharing your insights. I'm really, really glad that we got to connect and tell more about yourself.
Great. Thank you for the opportunity. It's great.
Yeah, truly, truly is my pleasure. Thank you, everyone, for watching this or listening to it. Be sure to subscribe if you have not as yet. Leave a like, leave a review, and share this with a friend who gets some value with it. Greatly, greatly appreciate it. I will see you all next week.